Hello. Hello. Hello.
Hello, ma'am.
Good afternoon, ma'am. Good afternoon, ma'am.
Good afternoon. Sorry. There was a problem, it's a slight problem. Joining. So how are you all?
Ma'am, good.
Hello.
How are you?
Yeah, can you see slide?
Yes, ma'am.
And can you hear me? Can you hear me today?
Yes, ma'am.
Okay, there is some recovery actually done by Damodar. Sorry, there was a problem in that sound system. So today it is recovered. Okay. So today topic is also small, so we don't need to be in a hurry. Last time we have covered most of that typical thoracic vertebrae. Only a typical part only is left. Okay, so we don't need to be in a hurry, and I think we are 4 minutes late also, right? So do you remember about the typical thoracic vertebrae features?
Yes, ma'am.
Okay, and somebody has asked about the slides, so today we'll complete this topic, right? Thoracic vertebrae 1 and 2. So after that I will upload, okay, the slides of thoracic vertebrae. So today we'll move to the atypical vertebrae, right? 2 to 8 we have mentioned, right? 2 to 8 thoracic vertebrae are the typical vertebrae which have similar, almost similar features. So it is difficult to identify them individually. Okay, so you can't identify whether it is 3, 4, 5, 6, 7 like that. Okay, till 8, but after that remaining vertebrae you can identify separately whether it is number 1 thoracic vertebrae or 9 and 10 are almost similar type, but 9, 10, 11, if you go for 12 thoracic vertebrae, so those vertebrae if you hold in hand by seeing is the particular features, you can identify those thoracic vertebrae. Okay, 1, 9, 10, 11 and the 12 thoracic vertebrae. Okay, so mostly for the viva we'll ask that is the first thoracic vertebrae. Like first rib was very important, right? Even for viva or sporters also first rib. Similarly, first thoracic vertebrae is also important. Okay, for even for sporters also, for viva also, right? We'll ask you to hold the vertebrae, and most features are very important features also are there in the first thoracic vertebrae. So you have to know by seeing it that it is first thoracic vertebrae. Okay, so you can see as we have mentioned, like upper part of the vertebrae like 1, 2 almost resemble to the cervical type, because upper you have 7 are cervical vertebrae, right? After immediately after C7 that is the first thoracic vertebrae. Okay, so body, mainly body, if you see of the first thoracic vertebrae, it will resemble like the C7, that is 7 cervical vertebrae. Okay, body of the 7 cervical vertebrae. So now last time also we have mentioned that is the typical vertebrae body. Right? Why we are mentioning this first thoracic vertebrae as a, that is the cervical type. So in the typical thoracic vertebrae, we have mentioned like that is the body, right? Diameter of the anterior posterior and the transverse diameter are almost equal. That means heart shaped. Okay, so normal heart actually, not what we used to think in 9-10 heart, but normal our body heart. Okay, so anterior posterior dimension and the transverse diameter are almost equal. We can't say that exactly, but they are almost near to equal. Whereas if you go for the cervical vertebrae, or that you can say the first thoracic vertebrae which is similar to the cervical vertebrae, that means in this case that is antero-posterior diameter is less, whereas the transverse diameter of the body will be more. Okay, so transverse diameter if you measure it will be more than the antero-posterior diameter in case of first thoracic vertebrae. Okay, so that is the one features you can see here. After that, the second features is like in other part you have seen the demifacet, the large costal demifacet in the body. Okay, that is the in the superior border in the posterior part of the body, that is the demicostal facet. Okay, on the that is the upper part. Whereas if you see in the first thoracic vertebrae. Same facet you can see, but that is circular full facet you can see in the upper part of the body of first thoracic vertebrae. Where in other case, in the typical, there was the demi-costal facet, but it was large if you compare to the inferior facet. Okay, so superior full facet, which is almost circular in the body of first thoracic vertebrae, that you have to remember while identifying the thoracic vertebrae. Okay, so and inferiorly in the lower border you can see the demi-costal facet, which is smaller, not circular like the upper superior, that is circular facet. Okay, that is the most important feature first to identify the first thoracic vertebrae. After that, if you see in the upper surface of the, we know that body has upper and the lower surface. So if you see in the upper surface, you will see somewhat everted type of the margin, and concave surface on the upper surface is somewhat concave. And if you trace the outer margin of the rim of the body of the thoracic vertebrae, superior surface, you can see somewhat leaping, upward leaping or projection on the upper surface of the body of first thoracic vertebrae, which you can see in the other thoracic vertebrae. Whereas in the inferior border, that upper surface is projecting upward, whereas in the inferior margin of the inferior surface is projecting again downward, just opposite of the, that is upper surface. Okay, so you will see that is the upward projection on the margin of the upper surface of the body of first thoracic vertebrae, and you can see the concavity if you face from side to side. Okay, that is the features which you have to remember. Okay, and other than that, you can see costal facet will be same, because it will also articulate with the tubercle, that is the facet on the transverse process, which will articulate similarly with the same, that is the first thoracic first rib. Okay, that is the articulation between the, that is the transverse process of the first thoracic vertebrae and the tubercle of the rib. Okay, after that you can see the another most important and the prominent feature again, that is the superior vertebral notch. This is also you can see in other thoracic vertebrae. Okay, so you know about the superior vertebral notch. So if you see the deep superior vertebral notch, then with the costal facet also present, then you can mention like it is the first thoracic vertebrae. Okay, so superior vertebral notch is very deep. Yes,
Ma'am.
okay, okay. So from where I
Thank you, ma'am.
start from? Okay, so superior vertebral notch you can see here, right? So here also you can see this is for the 9th, okay, 9, 10, 11, 12 thoracic vertebrae. This is the first thoracic vertebrae. Okay, so this you can see this in front of the, you can see superior articular facet and the body. This is the notch. Okay, so same way here also you can compare. This is the superior vertebral notch. So this vertebral notch, that is superior vertebral notch, is very deep in the first thoracic vertebrae, which you can't see in the other thoracic vertebrae. Okay, as you know, there are how many spinal nerves are there? Cervical. You have already studied, right? Spinal nerves. Do you remember? Spinal nerve.
8 pairs.
8, right? 8. And how many vertebrae are there? Cervical vertebrae?
7.
7, right? So we have 8 nerves, and that is the, and vertebrae are 7. So if you go from first thoracic vertebrae, the nerve will pass from the, in the first, right? That is at last the first cervical vertebrae. So from surface of the body, okay, that is the first spinal nerve will pass. Second, from the second upper surface of the second, like similarly C7 from the upper of the C7, right? Whereas 8th nerve has to adjust second, right? So 8th spinal, that is the cervical spinal nerve, will pass between the nerve, that is the inferior nerve, that is the inferior nerves of the C7, that is the 7th cervical vertebrae, and the superior, that is a vertebral notch of, that is the first thoracic vertebrae. For this reason, the superior vertebral notch of the first thoracic vertebrae is very deep, whereas other thoracic nerve, that is spinal nerve, if you compare, all will passes in between the inferior vertebral notch of this, and the superior vertebral notch of the second thoracic vertebrae. Suppose this is the second thoracic vertebrae, okay? So first spinal nerve, that is thoracic spinal nerve, now run in between the inferior vertebral notch of the first thoracic vertebrae and the superior vertebral notch of the second thoracic vertebrae. That means, so cervical spinal nerve are that is named according to from the superior notch only, right? Of the, that is for in between the atlas and the occipital bone. That is first cervical nerve. Whereas in case of thoracic spinal nerve, it will run in, that is a name according from the, that is the inferior vertebral notch. So from the inferior vertebral notch of the first thoracic vertebrae and the superior vertebral notch of the second thoracic vertebrae is the first spinal nerve. So that is the reason why that is the superior vertebral notch of the first thoracic vertebrae is deep. Okay. So now the same thing, that this circular facet that is articulates with the now first rib. Okay, the head of the first thoracic rib. It has only one head, that is the facet for the head. Okay, and the transverse process also, it has the facet which will articulate with the same number, that is one, that is first rib. Okay, that is the tubercle, articulating tubercle of the first rib, that is the costo-transverse joint forming. Okay, after that we have mentioned on the typical vertebrae, spinous process are oblique. If they go in the lower part, they are almost, that is obliquely, okay, and extended downward and backward. Whereas in case of first thoracic vertebrae, it is like horizontally placed and not very long like the typical thoracic vertebrae. Okay, like cervical type. In the cervical, normally it will be bifid, but short only. Here in the first thoracic vertebrae, it will be short and almost, it is the horizontal orientation of the spine of the first thoracic vertebrae. Okay, these are the typical features of atypical first thoracic vertebrae. Okay, very important feature. If you remember this, mostly in the MCQ also. So if you remember these features, 4-5 features from first thoracic vertebrae, then so after that, moving towards the 9 thoracic vertebrae, thoracic vertebrae. So by seeing the picture here also, you can mention the feature thoracic vertebrae. So like in the first, we have seen the full circular facet on the posterior part of the, that is upper border of body. In case of 9 thoracic vertebrae, now what you have to see, shape of the costal demifacet. Now it is demifacet again, that is only present on the upper border. Okay, just in front of the, you can, okay, just anterior to the pedicle, you can see the costal demifacet present on the, that is superior costal demifacet. Whereas if you see lower part, there is no demifacet. Okay, costal demifacet. That means absence of the inferior thoracic vertebrae in the body, and the presence of the demifacet in the upper, that is superior costal demifacet. Okay, other than that, almost are similar. If you see the costal facet on the transverse process of the 9 thoracic vertebrae, you can see the costal facet on the, so same thing, lower facet on his side absent, and the, if you remember, you can write the features of 9 thoracic vertebrae. Okay. You see the difference in the facet pattern in the 9th and 10th thoracic vertebrae. What do you have in the 9th and 10th? If you compare 9th and 10th, hello. What difference can you see? Vertebrae?
Complete facet and demifacet.
Hello. Yeah, complete facet on the, there is superior costal facet, and full facet on the superior surface of the body. Okay, in the 10 thoracic vertebrae, whereas in 9 there was the demi-costal facet. Okay, and inferior costal facet is again absent, similar to the 9 thoracic vertebrae. Okay, so body possesses the single articular facet that is almost oval or the semilunar shape that articulates with the, that is the 10th rib. Okay, head of the 10th rib. If you see the costal facet, it was somewhat far off from the pedicel. Here it will be almost encroaching the, this is the upper part of the pedicel. Okay, so costal facet is oval or semilunar, which is encroaching the pedicel. Okay, this is about the 10 thoracic vertebrae, and again you can see the costal facet on the transverse process of the 10 thoracic vertebrae, similar to the 9 thoracic vertebrae. Okay, clear between 9 and 10. Now towards the 11. Okay, so this is first, second, third, that is the, this is the 10th and the 11th and the 12th. Okay, now 11th you can see. I hope if you remember the rib, then you can write the features for the 11th and the 12th thoracic vertebrae also, right? So in the 11th and the 12th thoracic vertebrae, so you have not seen the articular tubercle, yes or no? That is the articulating tubercles are absent in, they are the floating ribs, 11th and 12th. So there is absence of the articulating tubercle on the 11th and the 12th ribs. So by that also you can see the transverse process, so absence of the costal facet on the transverse process. This is the transverse process of 11th and the 12th thoracic vertebrae. So there is absence of the costal facet on the transverse process of 11th thoracic vertebrae and the 12th thoracic vertebrae. These are the common features in between the 11th and the 12th. So now moving towards the costal facet, that is the full costal facet you can see in the body. Okay, so now you have to compare the location of the costal facet, that is full facet, on the body in the, that is the 11th and the 12th thoracic vertebrae. Okay, so in the 11th thoracic vertebrae, so you see here it is near to the pedicel, right? Almost was the root of the pedicel. Okay, that is the costal facet, that is full oval costal facet near to the root of the, that is the pedicel. Okay, and the transverse process now in the other part, normally in the typical transverse process are where that lies club shaped, that is wide, right, and their almost length was also more, whereas they are going to 11th and 12th mean they are approaching towards the lumbar type. So that means in the lumbar vertebrae, if you compare with the transverse process thoracic and the lumbar, they will have that thickness will be more, but their decrease in the length of the transverse process, that will be small and short transverse process in the 11th and 12th thoracic vertebrae. Okay, so transverse process now if you compare, they are very short or small and absence of the costal facet, okay, on the tip. Now moving towards the 12th thoracic vertebrae. So if you see here the costal facet in the body, the position of the full costal facet in the 11th thoracic vertebrae and the full facet is the 12th thoracic vertebrae, you can see the difference, right? It is approaching almost towards the inferior part of the, that is pedicel. It was almost root of the pedicel in the 11th thoracic vertebrae. Okay, so if you see the facet, it is almost towards the, that is the inferior part of the pedicel. Okay, single large facet towards the lower part of the pedicel, then towards the body of the, that is the upper part of the body of thoracic vertebrae. And if you see the shape also, like here it is almost, if you go down then it will be almost towards the lumbar type only. Okay, so it is, the body is also, size of the body is also enlarging, that means large size, because it, the the lower the vertebra is moving, then they have to weigh more weight of our body. Okay, that's why the size of the body is also increasing as it goes down. Okay, from 10, 11, 12. If you see, compare, size keep on increasing. Okay, so for this you have to take the vertebrae from the same body so that you can compare the increase in the size of the vertebrae. Like in our cases, if you see, we have different cadavers vertebrae, so it is very difficult to compare the size of 11 and 12. Like if somebody is very large size person, they have large body, right? If you have, then there will be small size, so you have to compare the same person vertebrae to compare vertebrae. Okay, so same thing resembles like the lumbar type. Okay, that is the and body process, that is the last postal facet, which is almost towards the lower end of the pedicel, and transverse process similar to the 9. Okay, it also has all transverse process, and other important feature which is present thoracic body, we mentioned like cervical type because of increase in the transverse diameter. The lumbar vertebrae, again we have different features, like we have the tubercles, numerous tubercles present in the, like in the posterior part of the superior articular facet, that is in the root of the transverse process, there are tubercle. So now you have to see the tubercle which are present features, like that is the, if these tubercles you see, that is you can mention like that is the 12 thoracic vertebrae with the presence of costal facet. So if costal facet is absent and if you see the tubercle, then you can directly mention like this is lumbar vertebrae. But if you see the facet with 12 thoracic vertebrae. Okay, so now we have 3 tubercle present, which is another features to identify, including the costal facet for identifying 12 thoracic vertebrae. Okay, so now moving towards the tubercle. So one is the superior tubercle. So superior, which is present, which is also known as the mammillary process of the lumbar vertebrae. Okay, so this, now you know about the superior articulating facet, inferior articulating facet, and the that is the transverse process and the spinous process, right? So this superior tubercle, which correspond, that is the name as a process in the lumbar vertebrae, which is now located in the post superior articular facet. Okay, which is facing where superior articular facet is facing posteriorly. Okay, so it is facing of superior and the posterior part. Okay, so you now imagine the posterior border articulating facet in the posterior border of the, so imagine posterior border of the superior articulating facet. So there is tubercle, which is known as the superior tubercle in the, that is the 12th thoracic vertebrae. Okay, that is the posterior border of the superior articulating facet. The tubercle is known as the mammillary tubercle or the mammillary process. Okay, in the thoracic vertebrae, and the middle tubercle, that is the true transverse process of the lumbar vertebra. What you see the transverse inferior tubercle. Okay, now you have to remember this mammillary and accessory tubercle you will see in the directly in the lumbar vertebrae also. In details you don't need to know. Okay, only you remember superior, middle, and the inferior tubercle. So inferior tubercle now is that represent the accessory tubercle vertebrae. Okay, inferior tubercle correspond to the accessory tubercle. Now towards the, you remember that is the root of the transverse process, and lateral side the apex is towards the junction between the pedicle and the lamina, that is the transverse process. So root of the transverse process you will see some elevation. Tubercle means elevation only. Okay, rounded elevation, that is known as the inferior tubercle or the accessory tubercle, which is present on the okay, so mammillary tubercle is present on the posterior border articular facet, and the inferior tubercle is present on the of the root of the transverse process. Okay, that is also known as the accessory tubercle. Okay. Now,
Can you please repeat once again? Your voice
first
is breaking.
Sorry.
Your voice is breaking. Can you please repeat once again? Yes, ma'am. Tubercle. Position of tubercle.
Okay, position, that is the superior tubercle. Okay, in the 12th thoracic vertebra is also known as the mammillary tubercle. Okay, so mammillary tubercle is present on the, now you have to imagine the posterior border of superior articulating facet. Okay, so facet is the presence of mammillary tubercle. Okay, tubercle is nothing but the rounded elevation present. Okay, so you can feel, if you touch that with the fingers, you can feel that protuberance or the elevation, that is known as mammillary tubercle. Okay, and middle tubercle, you can see that is the true transverse process. You can see normal transverse process. Okay, and the inferior tubercle now, that is present in the posterior and inferior part of the root. Remember, lateral part is the tip and that was the medial cell. It is attached in between the lamina and the pedicel is the root. Okay, that is the root of the transverse process. Okay, inferior part of the root of transverse process vertebrae is the inferior tubercle, which is also known as the accessory tubercle. Okay, that is only normally present in the lumbar vertebra. So 12th thoracic vertebra is also near to the lumbar, so this tubercle also may present in the 12th thoracic vertebrae. Okay, now a typical features, the same thing. T1, just now we have mentioned body cervical type. Okay, that you know now. And the superior full circular or oval facet present in the body. Okay, and you can see knots, that is the deep superior vertebral knots, that is another important features, and that is the horizontal tongue spine present in the T1. Now T9, that is the demi-facet costal facet, that you have to remember. Okay, other features are almost same, and the absence of inferior costal facet in the body. You can see the oval facet near to the pedicel. Okay, that full facet and the of the costal demi-facet in the inferior part. Okay, that is for the 10th. And 11th, you can see the facet is almost towards the almost enclosed, that is the root of the pedicel, and it is full costal facet with the absence of the facet on the transverse process and absence of the inferior costal demi-facet in the body. Okay, that is about the 11th thoracic vertebrae. And now 12th thoracic vertebrae, that is the full costal facet almost enclosing towards the, that is the inferior part of the pedicel. Okay, and absence of the costal facet on the transverse process and the absence of the costal demi-facet in the lower part of the body. Okay, and the presence of 3 tubercles. Extra thing is the presence of 3 tubercles, and the body also large size, and the transverse process are small and the short. Okay, that is about the 12 thoracic vertebrae, which resemble almost towards the lumbar vertebrae. Okay, that is a L1 also you can mention. Okay, now moving towards the ossification center. If you know all these features, then only we'll ask about the ossification center in the Viva. Those who answer everything, then we will move for the ossification center. Okay, so first you know all these general features for the typical vertebrae, atypical vertebrae, and if you answer all those, then you can answer for the ossification center of the vertebrae. Okay, so as you know, the thoracic vertebrae are the irregular bone. Like you can see now, you can say by the shape also, irregular type of bone consisting of total, you can see that is 5 plus 3, 8 ossification center. Okay, so 3 are primary. So those which occurs in the intrauterine part of the leg, right? That is the process of formation of bone, that is known as ossification, and the center present, right? Like in the long bone, if you see the shaft, normally we used to say that is the primary center, and the ends, right? They are the secondary ossification center. Whereas here you have to, it is different, right? So you have to remember separately over here. So in the vertebrae, generalized vertebrae also we can mention. It is not particularly for the thoracic vertebrae only. So it has 8, that is ossification center, including 3 are the primary ossification center and the 5 are the secondary ossification center. Okay, so first we will go for the primary, which occurs in the intrauterine life of our body. That is the one, now you have to remember, centrum. Okay, so what you see this part here, mainly you can see this is the centrum, which will form later on the body. Okay, now you have to remember centrum for the body, except this part of the body which is formed by the neural arch. Okay, so this part of the centrum, okay, is, that is a derived from one centrum, that is the one primary center. Okay, so this centrum from the one primary centrum, and after that you can see the division. Okay, this whole, that is pink color, you can see this is for the neural arch. Okay, from two sources you can mention, centrum and the neural arch. So centrum is the one primary centrum, and the neural arch are two halves. So one half and two half, one half from one center, one half from the another center. That means total of 3 primary center. Okay, whereas if you move for the secondary center, there are 5 center. Okay, so 5 center also in the marginal side, that is the annulus fibrosis, that is margin of the superior surface of the body. Now you have to remember superior surface of the body, inferior surface of the body, now and the tip. Okay, tip of the transverse process, 1 2, tip of the transverse process, now tip of the spinous process, and the superior part only. Okay, superior surface and the inferior surface of the body will be derived from the, that is secondary center. Okay, so primary center are the 2 neural arcs and the centrum, whereas the secondary center is for the upper and the lower surface of the body, tip of the 2 transverse process, and the 1 tip of the spinous process, that is the 5 secondary center. Altogether there are 8 ossification center for the vertebrae. Okay, so vertebral arch and the neural arch is same. Okay, vertebral arch or the neural arch. So now joint formation, I hope you have studied in the ribs also few joints. So in, this is the costo from the rib and the vertebra from the vertebral joint. Okay, that is costo vertebral joint. So costo means you have seen the, in the head of the rib there are facet for articulation with the, that is the thoracic vertebra, that is the, with the facet present in the body of thoracic vertebrae. Okay, so upper small facet in the head of the ribs and lower large facet, whereas in the thoracic vertebrae again upper large facet and lower smaller demi facet. So you can see here head of the rib. So here you can see this is the head of the rib, right? That is the vertebral end. You can see this is the, that is the costal end only. So in the vertebral end, that is the facet of the head articulates with the, that is the demi facet present in the body of the thoracic vertebrae. They form the joint that is known as costovertebral joint. Okay, so this is the costovertebral joint. The head of the typical rib articulates with the body of the corresponding vertebrae and along with the body of next higher thoracic vertebrae. Here you can see example, right? This is upper vertebrae and the lower vertebrae. Okay, so there is the articulation in between two. So joint are there. So this type of joint is the, that is the obviously synovial joint because movement is possible with the, that is the flat surfaces are there, that is the plane type of synovial joint is present. So now again this also you have to remember for your, almost all will get this question actually in the viva, to articulate this thoracic and the, that is the thoracic vertebrae and the ribs. Okay, you have to articulate properly also, and you have to mention the type of the joint and how it is related to the corresponding ribs and the vertebrae. Okay, so this is the synovial type of and the plain joint. Okay, synovial variety, plain joint is the costovertebral joint. So what are the ligament present? So you have already seen, I think in the lower limb, upper limb also you have seen that is the most important ligament covering, that is the capsular ligament. The one ligament present. Along with that is the radiate ligament and the intra-articular ligament. Okay, in details you don't need to remember. If you remember this part only, it is sufficient. Okay. So type of joint and how the joint is formed, that is very, very important that you have to remember. After that, we have in between the vertebrae. That was in between costovertebral, means in between the ribs and the vertebrae. Okay. Now in between vertebrae and the vertebrae, again we have two types of joint. Okay. So you can see here the blue color is the intervertebral disc, and these two are the body of the thoracic vertebrae. Okay. So in between the vertebrae is the thoracic vertebrae, is the intervertebral joint, one between the bodies of the thoracic vertebrae. Another is in between the, you can see the superior articular facet and the inferior articular facet. So inferior articular facet of the 9 thoracic vertebrae, so it articulates with the, that is the superior articulating facet of 10 thoracic vertebrae. So this is also in between the articular process, that is also intervertebral joint only. Okay. So one is in between the bodies of thoracic, other is between the articular process of the vertebrae. Okay. So now moving towards the, that is the in between the bodies, that is also you have studied in the classification of the joints in the general anatomy also. So all the joints present in the midline you have known like that. I think that is the secondary cartilaginous joint. Okay, in between the bodies of the thoracic vertebrae, that is the secondary cartilaginous joint. So you can see a disc here, right? This is the intervertebral disc, which is fibrocartilaginous joint also. So in this here, in the intervertebral disc also, you can see in the upper surface of body also you can mention there are two parts again. One is in the centrum part, central, and is the peripheral part. Okay, in the central part we have that is gelatinous substances, that is known as the nucleus pulposus. Somewhere you have studied, right? Remnant of, what is this remnant of? Nucleus pulposus.
Notochord.
Oh, okay, good. That is of the notochord. Okay, that is present in the center. That is very gelatinous. Okay, whereas in the peripheral margin, that you can see the very fibrous tissue. Okay, that is in the ring form. That is known as annular fibrosis. Okay, so this comprises of two parts: peripheral margin, that is known as annular fibrosis, and in the central part, that is known as the nucleus pulposus, which is the remnant of the one remnant of the notochord. Okay, other remnant you will study again later on. So these joints again are supported by two ligaments. So on the anterior surface of the body, that is long ligament, that is known as anterior longitudinal ligament, and the posterior part of the body, that is the posterior longitudinal ligament. These two ligaments will provide the support to the, that is the vertebral joint in between the bodies of the thoracic vertebrae. Okay, now joint between the articular processes, that is the superior articulating facet and the inferior articulating facet. These joint is very important for our body, actually in the thoracic part, which is responsible for the rotatory movement in the thoracic level, which is not present in the other part of the body. Okay, so you can see this joint is formed by the articulation between the superior articulating facet and the inferior articulating facet, which is also known as by the facet, that is known as facet joint also, or also known as the zygapophyseal joint. Again important for viva. Okay, so you have to remember what type of joint is formed. Okay, so it is again plain type of synovial joint, because the facet are almost flat only. Okay, superior and inferior articulate facet are almost flat and they are vertically directed, and these will permit the slight gliding movement and the rotatory movement in the thoracic, that is the level of the vertebral column. Okay, so this will not allow the rest of the joint. If you see in the cervical, lumbar region and the sacral region, their movement is like, you can see flexion, you can see extension, and the lateral, okay, lateral extension you can see. Okay, this part of the vertebral column, whereas the rotatory movement, that is the rotation, is only present in this part because of this type of joint, that is the zygapophyseal joint present in the thoracic vertebrae between the superior and the inferior articulating facet. Okay, now moving towards the costo-transverse joint. So now by the name here also you can guess, in between the, that is the vertebral, costo means rib, you can see. Okay, in the articulating facet, that is the present on the, that is the articular facet in the ribs. Okay, and then there is the transverse process, that is facet present on the anterior part of the, that is near to the, that is tip of the transverse process. Okay, that is the facet present transverse process. These two articulate to form the costo-transverse joint. Okay, that is costo-transverse joint between the articulating tubercle of the rib and the, that is the facet present on the transverse process of the thoracic transverse joint. Okay, so this joint definitely will be absent in the 11th and the 12th rib because they are absence of the, that is the facet on the transverse, again are of plain type of synovial joint. Okay, ligaments like capsular ligaments are present. Superior costo-transverse ligament, which is present between the inferior border of the transverse process of thoracic vertebrae and the superior margin of the neck of the transverse process, that is the superior costo-transverse ligament, and the lateral transverse, that is the costo-transverse facet, that is the facet, transverse facet. Okay, lateral rib, that is the lateral transverse ligament. Okay, part of the transverse process. Okay, that is the development. So in details, again you don't need to remember the details about the development of the vertebrae. So whatever I mentioned, that much if you remember, that is sufficient. Okay, so now you have studied, that is mesoderm, right? These are developed from the mesoderm. In the mesoderm also we have studied, that is the paraxial mesoderm. Okay, in the paraxial mesoderm there were the somites, right? Somites, now somites are sclerotome, myotome and the dermatome. So these vertebrae, that is bones, are developed from the sclerotome of the this. Now moving to our individual part, so we only have to discuss about the thoracic vertebrae only. Contrast. So green color you can see, these are developed from the neural. So three components. That is the arch will give rise to posterior part. Like this is the centrum. Okay, blue color. And small part of the body. Okay, that is developed from neural arch. Now you can see that is the, okay, and the spinal process, pedicel you can see. Okay, superior inferior vertebral arch, superior articular facet. Okay, these all are developed from the green color, are developed from the neural arch. So you have to remember neural arch. And for the centrum, blue color, that is the body part. This part of the body is developed. And in the thoracic vertebrae, definitely coastal element are the ribs are forming from the coastal element. Okay, this part only. Okay, this is about. So now for the vertebrae only, you can remember the neural arch and the centrum. Okay, coastal element, that is the ribs, which is present only in the thoracic vertebrae. A thoracic, that is in the thoracic part of our body only. Okay, so neural arch of the vertebrae and the centrum will give rise to this part. Okay, that much you can remember. Development of the thoracic vertebrae. Okay, Now, same thing here. These are the two neural arcs, and these are the centrum, and this is the junction. That is the neurocentral joint pattern, which will fuse to form the as a whole vertebrae. Okay, neurocentral junction, that is joint centrum and the two neural arcs. So there should fuse to become the normal vertebrae. Okay. So now, if you see here, if there is any defect in the two neural arcs, you can see there is the deficient, that is the neural arch, that is failure of the fusion. Okay, in this case their condition is known as spina bifida. Remember that term only, that will be sufficient. So there are two half of the neural arch fail to fuse in the midline, which will lead to the condition that is known as spina bifida. So in detail about this condition, again you study in the fourth semester in the neuroanatomy only. So for now you can remember spina is the failure of the fusion of the two neural arcs in the midline. So how you normally, by doing the USG, right, ultrasonography also, you can see of the fetus with the spina bifida, and better examination is by taking out the amniotic fluid. Okay, in that amniotic fluid we can test that is alpha fetoprotein, which will be increased. Okay, in case if the fetus is with the in that case you can see increased amount of alpha fetoprotein. Okay, amniotic fluid. Okay. So other bifida are also there. Okay, in the thoracic part, that is the spina bifida only. If you remember, that is sufficient. Okay. So can we answer now MCQ question number 1? I hope you all can answer this question. What type of joint is seen in between the superior and okay, plain type of sign was very good. Okay, and second question.
B.
Coastal demifacet.
Okay, coastal demifacet. Okay, that is typical you have to mention. And third. So sometimes we don't ask incorrect answer or which of the statement is false, right? In normal MCQ, but here it is practice question, so we can keep like this question also. Okay, normal incorrect or the false statement we don't keep. Okay, so can you tell the answer for this question?
D.
Okay, absence of the facet in the transpose process. Okay, so I hope you all understand this topic. Thoracic vertebrae. Yes.
Ma'am, T1 nerve will be below T1 vertebrae or above T1 vertebrae.
Sorry.
First thoracic nerve will be below first thoracic vertebrae or above first thoracic vertebrae.
Typical. What question? Please. Sorry.
Ma'am, first thoracic vertebrae will be below first thoracic nerve will be below first thoracic vertebrae or above first thoracic vertebrae.
Yeah. In upper part that is cervical spinal nerve, right? And the first thoracic spinal nerve will be below the first thoracic vertebrae, from the inferior vertebral notch of the first thoracic vertebrae. Okay. This is very common question for your Viva also. Okay, you have to remember that is from the superior vertebral notch, which we have mentioned that is very deep, right? That is deep is for the 8th cervical spinal nerve, whereas the inferior, that is the first thoracic spinal nerve, will run in between that is inferior vertebral notch of the first thoracic vertebra and the superior vertebral notch of the second thoracic vertebrae. Okay, that is the difference in naming the spinal nerve also. So in the cervical spinal nerve, what we have mentioned, according to the upper, where the spinal nerve is located from the upper part. So that is the first spinal nerve is related to the upper part of the first cervical vertebrae. Whereas for the thoracic spinal nerve, how you will mention, like the below, upper part is the vertebrae, lower is the spinal nerve. Okay, are you clear? From the lower thoracic vertebrae, That is the first thoracic vertebrae. Lower vertebral, sorry, inferior vertebral notch is the first. That is the thoracic spinal knob. Is that your question, right?
Yes, ma'am.
Did you get or not?
Yes, ma'am. Yes, ma'am. One more question.
Ajay.
Ma'am, can you
Okay.
go to any one slide having the picture of vertebrae?
Okay. Normal vertebrae, right?
Yes, ma'am.
Or any?
Any slide number 8,
Vertebrae.
9, 10, anyone.
Okay. This one okay?
Yes, ma'am. Ma'am, which one is superior articular
individual
process? This is okay, ma'am.
Sorry?
Ma'am, which
Okay.
is superior articular process?
Facet, there is a facet present here. You can see this one. Here also you can see this one. This is superior and the which is facing, no, this is inferior facet. These are inferior facet, blue color. You can see here also superior articulating facet, superior articulating facet. Here also you can see this is superior. In here you can see joint again. This is the inferior facet and the superior facet. This is the joint in between the superior and the inferior articulating facet. Okay? See here. So this is the inferior articulation, just behind the inferior vertebral notch. You can see this facing downward and forward. This is the inferior vertebral facet, that inferior articulating facet, and this is the superior articulating facet. This is 9th, this is 10th, right? So you can see inferior articulating facet of 9th thoracic vertebrae and the superior articulating facet of 10th thoracic vertebrae will form the interarticular joint. You can see this one. Is that clear?
Yes, ma'am. Thank you.
Okay, you can in real you can see this real facet also, right? So here it is also clear. Blue color is for the facet. Superior facet, superior facet, superior articulating facet. Here inferior facet is region, right? This part, this swelling type is the inferior articulating facet of 9 thoracic vertebrae, and this is the superior articulating facet for 10 thoracic vertebrae. Okay? Are you clear?
Yes, ma'am. Yes, ma'am.
Okay. So wait for a while, okay? Attendance. Oh. Recording will. Okay, thank you class. So I'll upload now, okay, the slide for thoracic vertebrae. Okay, thank you.
Thank you, ma'am.
Okay.
Thank you, ma'am.